So this is Tinting. We're going to go ahead and place a cephalic catheter on him. We've got all of our supplies laid out. We've got our tape cut already, chlorhexidine, alcohol, some 3x3s, set wrap, our clipper blade, and then our catheter and our T-set. So we'll take our catheter. This is a 20 gauge catheter, and we're going to go ahead and just flush it with some heparinized saline. Make sure we don't have any air bubbles. And we'll just set that aside. And we'll do the same with our T-set. That way it's already prepped and ready to go, so once we get the catheter on, we can just connect it. So Daniel's just got him sitting here, and he's just pushing out his forearm here. I'm just going to take a hold of the paw, and we'll just do a really good shave, just so we get all the hair around the catheter site prepped and keep it nice and aseptic. Good job, Tinting. I know, buddy. That extra hair here. Good boy. So what we'll do once we have all that hair off, Daniel's just holding off that vein so you can see it distended here. We're just going to do an initial scrub with the chlorhexidine, and this is just going to take off all the excess hair, so I'm not worried about moving everything and getting the hair in the way, because I'm going to do a aseptic prep in just a second. Okay. Good boy. I know. So now we'll take a square here and just focus on the site that we're actually going to put the catheter in, so making sure not to drag this square into any of the haired areas. So we start with Chlorhex, and then we'll come in with alcohol. And back in with Chlorhex. Again with alcohol.
Hi, Karen. It's Dr. Jones. How are you? Good. I just finished up my ultrasound statement.
Last time with Chlorhex.
Like around her pancreas is inflamed, so she might have something called a pancreatitis.
And then lastly with our alcohol.
How is she doing at home? I know she saw Dr. Frieden yesterday.
So now that our site is nice and prepped,
Okay.
our catheter here, bevel up. Just go ahead and insert this into the vein. Once we see that flash of blood, we'll just go ahead and push the stylet on through.
Okay.
I know. Put a little pressure on the vein so hopefully none of the blood gets out here. Go ahead and take our first piece of tape. And Daniel's let off his pressure, and now he's just holding the limb behind the elbow just to keep it extended so it's easier for me to hold on to. Oh.
Okay.
I'll just use this first piece of tape here.
Okay.
Good boy, Tinting. Good boy. And we'll take a 1-inch piece of tape that we'll just go ahead and make a little slit in so it fits right underneath the catheter.
Okay.
It's okay, Tinting. You're Good boy. Good boy. We're almost done, buddy. Just hold him tight. Good boy.
Okay. Yeah.
You're okay, Tintin. Good boy. Almost there, bud.
Right. Yeah.
Just gonna just put a little pressure right here on the catheter and just attach our T-set. And pull back, and we've got a little bit of blood there, so we're just gonna go ahead and push and flush about 2 cc's through.
Looks like there's a lot of inflammation around her pancreas, so I think it might be her pancreas itself.
Clamp
But
off
I'd like to run a quick
here.
blood test too, just to confirm that if it is something like pancreas,
There, buddy.
treat that differently than other things. So we could go ahead and get that done right away. If that's okay.
Take a little small 1/2-inch piece of tape and just wrap this right around the T-set. What we call a little bra just to keep the T-set in place. And then the last piece of tape we'll just wrap right around the T-set and attach this to the rest of the limb. Good boy, Tintin. Good boy. You're okay.
Hey, that's knowing what's wrong with it.
Almost done there, buddy. Just flush the rest of our hep saline through. And we'll take our sterile cap and attach that. And last but not least, just wrap the catheter with some vet wrap. You're okay, buddy. Good boy. And we're all set to hook them up to fluids. Major things when we are setting catheters, it's really important that we're monitoring our catheters throughout the day, throughout the next couple of days if it's going to be a long-term catheter. We want to make sure our veins aren't blowing, that the fluids or the medications that we're putting in via the IV are actually going in IV and not going in the sub-Q or the tissues around the IV. We can oftentimes get infection there because we are creating a site from the outside to the inside of the body. So we need to watch the catheter for any infection, for hematoma, for anything that's swelling around the catheter site. So it's really, really important to make sure we're looking at that. It's also something that the dogs or cats are not used to having on or in their body, so they're going to be more prone to going after the catheter. So again, really important to wrap with vet wrap. We can use some elasticon, just kind of creating these barriers to keep them away from actually chewing out their catheter or ingesting parts of the catheter itself. It's not uncommon at all to see in the vet practice, and we see it on a daily basis. So as much as we can try to prevent it by wrapping it, by getting e-collars on them, just kind of creating a barrier from them, getting these important fluids or medications that they need throughout the day. We don't see too much infection, but with these interdwelling catheters that are sitting in there for several days, sometimes after 2 to 3 days, it's important to just take that catheter out and place a new one if you're going to have a patient that's in the hospital for a lot longer, just so you reduce the risk of infection, you reduce the risk of irritation or hematomas or sloughing of the tissue around the catheter. But otherwise, I think we do a pretty good job of just kind of watching our patients, looking at the catheters, flushing the catheters frequently or every time we're unhooking fluids. We're flushing with heparinized saline to keep clots from forming, and just to make sure that we're still having a catheter that's running IV rather than in the sub-Q.